In tonight's Health Spotlight, the CDC released a special report about the surge in antibiotic-resistant bacteria that is sweeping the U.S.
And joining us now to talk much more about this report is Wish TV medical reporter Dr. Mary Gillis. Mary.
Okay, thanks, Phil. Alexis, according to health officials at the agency, the pandemic erased decades of progress in the fight against life-threatening antibiotic-resistant bacteria. They're also known as superbugs. Drug resistance occurs when bacteria, fungi, and parasites evolve and therefore no longer respond to treatment that would have otherwise wiped them out in the past. I spoke with Dr. Jason Sull, who tells me where it all went wrong.
Pandemic has been extremely challenging for all of us. Healthcare sector, probably the greatest, even the veterinary sector. So we have issues with, types of infection control, things that we would have had, such as masks and gloves. We have shortages on those. We have shortages on staff. We have, and all of these things, as well as probably other challenges, have resulted likely in increased use of antibiotics when they probably didn't need to be used.
Sull says this is a problem because the more we use antibiotics, the more ineffective they become. This is how superbugs evolve, become more pathogenic, and become resistant to treatment. Michael Craig, director of the CDC's Antibiotic Resistance Coordination and Strategy Unit, said in an interview, the COVID-19 pandemic has unmistakably shown us that antimicrobial resistance will not stop if we let down our guard. There is no time to waste. The best way to avert a pandemic caused by an antimicrobial resistant pathogen is to identify gaps and invest in prevention to keep our nation safe. The World Health Organization has named drug-resistant superbugs one of the 10 greatest public health threats to humanity. Reporting from the studio, I'm Wish TV's medical reporter, Dr. Mary Gillis.